So just a word or two. I'm honored and privileged to lead the Kraft Center, and for me, it's a remarkable fit. Like some of you, I'm looking around the room at the different ages we see here. I grew up in the 60s. It was a time of social unrest, civil rights, Vietnam, the second wave of feminism, and at that time there really was a national conversation about our collective sense of social responsibility and a belief that we could work towards a more just society and that it was our obligation to do so. There was a feeling of moral outrage at social inequities, and that was openly shared and discussed. This wasn't my experience when I went to medical school and when I entered medicine. There, the focus was insular, with almost no mention of the social determinants of health other than as impediments to our patients behaving as we would have liked. We focused on illness and treatment, pretty narrowly defined. I'm a psychiatrist. I trained at Bellevue because I wanted to take care of very sick, very poor patients. It was a great choice. And I've worked for more than 30 years on the interface of academic medicine and community mental health, trying to build and strengthen relationships to do two fundamental things. First, to invest in the care of people with severe mental illness who live on the fringe of society, marginalized, criminalized, and often voiceless. And second, to invest in trainees, to introduce them, seduce them, excite them about taking care of really sick people who live much too difficult lives. So when the Kraft Center for Community Health Leadership was being imagined, it felt familiar and felt like known territory, but on a bigger and broader scale with the potential really for great impact. And now, just 2 years into it, we've established proof of concept. We can recruit and retain remarkable physicians and nurses, and we can collaborate closely with community health and mental health centers. Our faculty includes more than 50 people from the Brigham and Women's Hospital, Mass General Hospital, the Harvard School of Public Health, national leaders in public health, community health centers, and the Mass League of Community Health Centers. And our trainees are doing important work that's important to their health centers and communities and beginning to disseminate it. They're speaking and writing. They're learning effective advocacy. And it's our job to nurture and sustain them. I am so proud of all of them, inspired by their commitment to social justice and confident in their ability to lead change. We have an exciting morning ahead. We'll be hearing from the biggest rock star in global health, Paul Farmer. His tireless, relentless, and impassioned commitment to providing care to those most in need is a source of constant inspiration. He is our moral compass. 3 of our graduates will present their work and ideas in the first half of the morning, and in the second half, we'll focus on empowerment and partnerships through a panel discussion with some of our graduates, a patient, community health worker, and a community partner. I also urge you to stay for our poster session where you'll be able to get a broader view of the work that's being done by our trainees, some of the projects that have been initiated, and have a chance really to talk with them directly. So congratulations to the class of 2014.